You can continue to eat and refrain from visiting. I am here to introduce our next speaker. He's a friend of mine, Ron Panzer. He's with the Pro-Life Healthcare Alliance. Ron is the founder and president of Hospice Patients Alliance. Whenever I have a question about hospice, I go to Ron. So I'm sure you'll have lots of questions for him when he gets done. Let's see, is there anything important I should tell them about you? He's from Michigan, so he came a long way. Thank you.
Okay, well, we're here to talk about healthcare in crisis, and the reason healthcare is in crisis is because society is in crisis, and healthcare is a reflection of what's happening with all the people. If we have a desire for authentic healthcare that is based on Judeo-Christian worldview or values, we need authentic faith in action among the people who are nurses and doctors and all the other healthcare professionals and the lawyers and the judges and those who are caring in the healthcare setting have a sacred trust. All fields of activity in our society can be done in a right spirit and create a culture of life. But when all economics and politics, religion, and healthcare and the courts are perverted with dishonesty and greed and ambition, that creates the culture of death. The culture of death has many faces. These are faces of evil, and there are different aspects of it. It's not just abortion, it's not just euthanasia, it's sex trafficking, human trafficking, slavery, hatred, all of these things, greed, and the denial of basic human rights. All of these things are denials of human rights. When the ministers and priests and rabbis in the countries of the world fail to teach the people, at least the ones who are their parishioners, they have been deeply responsible for much of the culture of death because they are the trusted shepherds of the people. And there was a time when most of the people did go to church or the synagogue or wherever they worship. And the ministers, especially after the Johnson Amendment and other things with the nonprofit laws, the ministers said, well, I can't talk about politics, I can't talk about certain aspects because then we might lose our nonprofit status. And this is a terrible mistake. First of all, that is not what Jesus taught, and it has nothing to do with spirituality to make decisions about what we're preaching and what we're talking about based on a government manipulation of the churches and the synagogues and places of worship. The people are to trust in God like you're walking on water. You trust that God is going to take you through, and maybe there will be a stone there and you can find your way through. You may not know where that stone is until you step and you find, oh, there is a step there under the water. You can survive and actually thrive. But this failure of the ministers has shifted society in a direction that's very dangerous. And so I hope that any of us, all of us, times have a conversation with the ministers and the priests to ask them to be more forthcoming talking about these issues and to trust in God. Even if the church has changed their legal status from nonprofit to for-profit, they would end up with the same thing if they spent all the funds that were taken in during the year for the service of the poor and the hungry and the needy. There would be no taxes to pay anyway. If we're Christians or Jews or whatever we are, if we have faith in God, then whatever we take in is to be given out. If we're trying to hold on to it, that is not the path. And so we have beautiful facilities, but sometimes our minds and hearts are not on the mission. So this whole thing with the nonprofit corporations of the churches has been an impediment to keeping the culture of life in society. So I just want to make that point. That's a very important aspect of how we got to where we are. Originally in this country, the churches were the centers of politics. The leaders met in the churches, the ministers, the priests were talking about politics because politics is the relationship of the people in society, and the church has everything to say about it. But they have kept silent about these things and restricted, okay, we can only talk about Jesus said this, and the apostles did this, but there's more to it. It's the application of our faith in life. The other part of this is that the men are not involved in the pro-life movement as much as they need to be. And how we get men involved is a difficult question. But I find, and probably most pro-life leaders find, that mostly we hear from women. The women are the caregivers, and it's natural for them to be involved. But to have an impact on society, somehow we have to find a way to reach the men. I know in this church there is an outreach, a very active outreach to the men, to get the men involved in spiritual functions and doing good works. But we need more of that. And so we need to spread this message, the outreach to the men. Somehow we have to brainstorm, how do we do that? Anyway, with authentic faith, we can create the culture of life. I know in my life, there were some people who would preach at me, and it didn't touch me. But then there were other people who didn't preach at me, but who were true Christians. And I can never forget that. We must be willing to risk all and leave anything if it's necessary for what we're called to do in life. We must recognize what our God-given gift is and use these gifts for His service and for the pro-life movement. The pro-life movement is Christianity in action in life. There's no separation between pro-life work and what we are as Christians. Those who see Him know He is pure beauty and kindness and love. And those touched by Him have an authentic faith. They are sincere, and they ask Him to come into their lives and to the lives of those they touch in their own circle. But healthcare is in crisis because our faith is inadequate, we're distracted, and we have not been sincere enough or willing to sacrifice Him. And so many of us have betrayed Him and the people. And so we have a culture of death. Julie is like a mirror to me. She's talked about some of the things I want to talk about. Hippocrates did say we should never give lethal medications, we should do no harm. And yes, the doctors since the 60s, many of them do not take the oath to do no harm. They have modified that, and they actually use words that say, if I take a life, I have to do it wisely or carefully or something like that. They actually have permission to kill in the oath that some of them take when they graduate from medical school. So they're being indoctrinated from the very beginning in a culture of death worldview. We can't just try, I mean, it's important to try to change the laws and pass good laws that protect life, but you can't succeed if the people are not of the same worldview. We have lost the Judeo-Christian worldview among the people. You have 50% maybe of the people who are very secular, culture of death type, and maybe 50% or more who are nominally Christian, but how many are very active Christian or active in service to promote the culture of life? Many people sit back and figure somebody else is going to do what needs to be done, and then when a problem arises, well, they say, how come things are so terrible? It's because you and everybody else didn't do anything. I talked to thousands of people over the years, and many of them say, oh, I will do something. I really want to change things. And then 1 out of 1,000 or maybe 5,000 ever do anything, hardly. And so the killings continue, and people are confused. They don't understand why things are the way they are in the hospitals. Why do the doctors have these committees that make those decisions? It's not just that they have the committees for feudal care, it's why are they thinking that way? And basically, they have abandoned the great thrust of Western civilization, coming out of the Greek philosophers, some of them, with Aristotle especially, based on looking at true empirical observation of reality. Philosophy and politics matter because they determine the decisions that we make. There is not just one ethics. People will say, that's not moral. But then the other person who believes totally different says, well, you're not being moral. I think it's moral to kill the people. So they have different systems of ethics, and we have, as a society, shifted. In other words, there's a complete shift. The power structure in the country has completely shifted away from the Judeo-Christian worldview. And that's why they make the decisions that they're making that just don't make any sense to people of faith. So Aristotle actually was considered a founder of science, and there is no contradiction between true faith and true science. Because when we're people of faith, we want to know what the truth is, whether it's the truth of God or the truth of reality. But sometimes science is perverted, it's politicized for various purposes in order to promote a certain agenda. So the culture of life encourages all science and true exploration of reality, but the cultures of death, all of them, are based on deception. You can go back to the story of the Garden of Eden. That's basically starting the culture of death, humanity, disobeying, not trusting in God, through pride. And people who subscribe to a culture of death don't tell the truth. They lie all the time, or most of the time, or they tell a partial truth, or they omit the truth to the families and the patients that we see, that we care for. And so then the patients are victimized and the families are filled with anguish. So we have to understand, when we're dealing with people who are like that, you cannot trust what they say. You have to be informed. So I wrote the Stealth Euthanasia book and Restoring the Culture of Life book so that people can understand these things and be prepared to encounter the healthcare system. When they go into the healthcare setting, a patient, someone in our family is going to go into a hospital or a hospice at some time or another, because we're mortal human beings. We all are going to have this confrontation. And everybody needs to know the truth about what's going on, because most people expect the illusion that the culture of death is the counterfeit. But we're called to provide the authentic healthcare, the authentic service to the people. And the people are thinking, oh, they promise that when I go into the hospice, we're going to get nursing care, doctor supervision, nurse aides, social workers, dietitians, speech therapists, physical therapists, occupational therapy, and a few other things, medical equipment, and the medications provided. This is all part of the hospice Medicare benefit. What happens is some people are actually lured into hospice, even if they're not terminal, because they'll say, well, we have all these services. They'll show the brochure. And then, well, they're signed up and they feel caught. And the hospice people are manipulating them if they are the counterfeit hospice or a rogue hospice. And then sometimes medications are withdrawn. I'll get into that a little bit later. The problem is we normally trust the doctors and the nurses. Up until very recently, as Julie mentioned, the healthcare professionals were some of the most trusted professionals or career people in the whole spectrum of industries, especially nurses. But now you have nurses who are killing people. I know a doctor in the South, not in Texas, I can't mention what state he's in, but he was the medical director of one of the biggest hospices in the country. And he told me that the nurses were lying to him about what the patient's condition was. And they would say, these patients are in severe pain. This doctor was the kind of doctor that still does house calls. So he knew the patients. He even took some of them fishing, he told me. But anyway, he knew that they were not in pain, but the nurses were asking for pain medication orders, morphine, Dilaudid, fentanyl, powerful drugs, when the patients didn't need it. And if you give a medication that is not clinically indicated, you are going to harm the patient. Everything that's done in healthcare, like most things, has to be done just so. If you're a carpenter or you're sewing a dress, it has to be done just right or it won't turn out, even baking a cake. So in healthcare, we have standards of care. And every niche of healthcare has their own standards that are particular or suited to the clinical condition. And in hospice, these are end-stage diseases. You have extreme symptoms out of control, or extreme symptoms. They're not always out of control. But there are very specific techniques or treatments for all these different diseases, and they're very different. Each disease process has a different way of handling it. And I have books. I have a friend who's a professor of palliative care medicine. She's Catholic, she's pro-life, and there are good palliative care doctors and physicians and nurses, excuse me. And she's written many textbooks. Her name's Kim Kubler. You can look her up, Kuebler. She's published with Saunders. Many internationally known textbooks. And she goes into great detail about the different types of treatment for heart failure, for COPD, and stroke, and many other diseases. But what happened with that doctor at the one of the large hospices, they were lying to him. He went out, visited the patients. He saw that they were not in pain, and then he went to the board of directors and the administrator, the chief administrator, who through the years I actually had some run-ins with him online, but that's another story. Anyway, he did manage to protect and save those patients, and it created a big fight within the hospice, and it ended up that some nurses got fired. And what happens is the board of directors of many of these hospices, even if they're culture of death hospices, many of the board of directors are really good people, and many of them are people of faith, but they have no idea what's going on. And you can be a volunteer at a culture of death hospice. If you don't know healthcare, if you're not a nurse or you don't know enough about healthcare, you may be looking at someone being killed right in front of you and have no idea that it's going on because it looks very peaceful. I mean, if someone's sleeping, well, that's very peaceful. What a wonderful, beautiful death. But that's murder if they didn't need the morphine. So you need to be informed. The people need to be informed. Now, medicine is a guild, okay? We forget that. We think that doctors are, they're just out there doing their service, but, and we think of like truck drivers, they're unionized. Doctors aren't unionized so much, but believe it, they are a guild. They stick together like glue. I have 6 doctors in my family. My father, 2 uncles, my brother, and my 2 nieces. Okay, so I know doctors. They stick together, but they like to think that they're all-knowing. They're very arrogant, many of them, not all. But I would witness my 2 uncles arguing with my father all the time, but if they're all-knowing, how can they disagree? So I learned very young that they're not so all-knowing and they're not so perfect. And doctors can disagree about a lot of things. Anyway, in the 1800s, there was a Dr. Semmelweis. I just want to mention him to give an example of the narrow-minded bullheadedness of doctors. Dr. Semmelweis was in a hospital in Europe, and he noticed that over 90% of the women were dying in childbirth. The doctors at that time, they used to go down to the morgue to study anatomy, and then they would come up and deliver the babies without washing their hands. The woman would get puerperal fever, die, and they just thought, well, that's the way it is. Dr. Semmelweis figured out, well, we need to wash our hands and use antiseptic solutions, and he reduced the death rate of the woman by over 90%. But even though he proved it, the doctors at that time still ridiculed him and thought he was an idiot, and they harassed him. He actually had a nervous breakdown and ended up in a mental asylum. But he was a great pioneer, like Dr. Lister, Florence Nightingale, Clara Barton. These are people who talked about hygiene and saved the soldiers when they were dying from infection from surgery, not from the surgery. So people in healthcare, somehow, how do we reach them? It starts with the family, the parents teaching the children, the culture of life values, faith values, so that you raise doctors and nurses that have the right worldview. The problem is the worldview has been subverted intentionally, and this has happened since the late 1800s, mostly by socialists who have, at least in the United States and Europe, have intended to remove the Judeo-Christian worldview. the feminists. The first wave feminists are those who wanted actual, really good rights for women to vote, to be treated justly in marriage, and to have property rights. That's first wave, and that's what you think, most people think, oh, feminism, they wanted liberation, good things. Okay, fine. But the second wave was the Betty Friedan feminism in late 50s, early 60s, where many people ended up having divorce. The children were damaged forever or scarred. And the thrust was anti-marriage, anti-family, anti-Judeo-Christian values, because socialism is the misplacement of our faith in God and placing that faith in man's control of government. And so they talk about social justice, especially in South America, where there have been dictators in the past, terrible dictators, and maybe capitalism. So they thought socialism would be better. They talk about social justice. But social justice as a movement is a communist-flavored agenda, political agenda. True social justice does not arise from forced giving and taxation. It comes from our heart. So if I sacrifice time or money and give to the poor or do something as a service, that's social justice. But if you have the government seize the money of the people and control everything in the name of social justice and doing all those things for the children and the poor, you keep the people poor, just like our welfare program has not solved any of the problems with the poor. Anyway, we have to understand that a lot of the culture of death today is related to communism and socialism. Feminism is just an expression of socialist thinking. Most of the feminists were socialists, and if I think of Bill Clinton, for example, he was doing all kinds of terrible things, and he's a known woman abuser, a disgrace to the office of the presidency, but the feminists loved him, never criticized him. Why? Because he was promoting Patient Self-Determination Act, so-called, and socialist, liberal-leaning things. Now, the Democrat Party and Republican Party, or you could say liberalism and conservatism, both appeal to the heart of different people. People who are Democrats and are Republicans, they all think they're doing the right thing. They believe, if I'm a liberal, then I'm thinking, well, government's going to protect the people from the abuses of the evil corporations, or protect the environment, or do these things for the people. If I'm a conservative, then I'm saying we're going to limit government, but have it do the just role of protecting the people, the national security, and things like that. So we can't condemn left or right. As Christians, we're not left or right. We're Christians. We have faith. And we can't be condemning other people because of their political view. We have to understand that their conscience has not been informed correctly. They don't have the right information. If they're pro-abortion, it's because they don't understand human life begins at the very beginning when a sperm touches an oocyte, and there's a process, a developmental process that is begun at that very moment that continues through all of life. And that is a unique human individual. I think we shouldn't call what's formed an embryo or a fetus, but we should say an embryonic human being, a fetal human being, because that is what we're dealing with. Now, in healthcare, modern healthcare and hospital care was started basically by Florence Nightingale, if we want to give credit to where it should be placed. She went from England to the Crimean War and saw people dying from infection from the surgeries and many other things. And she instituted modern hygienic measures. She was a genius, basically, of statistics. And everything in quality improvement in healthcare today traces back to Florence Nightingale. She was basically, in a sense, disabled after coming back from the war due to illness, not a physical, that she couldn't move, but she had an illness that some people really don't know exactly what it was, but she caught something that was a lifelong struggle for her. But she continued to advocate for higher standards. She wrote voluminously about standards of care, opening up the windows, fresh air, good food, attention to all the little details that make the difference in promoting life. And she was called to serve. She was a Christian, and she loved God, and she did this against the wishes of her parents, who they were the ultra-rich, the aristocrats of the highest level in English society, but she threw that away in order to serve the people. Another person we need to remember is Albert Schweitzer. He was a medical missionary. Most people today have no idea who he was, but he coined the term, or at least popularized the term, reverence for life. He wrote a book about it, and he said that, Descartes said, the only thing we can be sure of is that I think, therefore I am. But he was wrong. The one thing that we all know, and even animals know, to a sense, is that we're alive. We all share life, and because we share that life, we need to have reverence for life. And that's where the culture of life comes from. Now, Cicely Saunders is the founder of the modern hospice movement. There was hospice before. The Christians, through the Middle Ages, they cared for the dying. But she brought modern science into the picture of caring for those who were dying. And she trained with some at a facility. There were nuns at a certain facility she went to in London. And she learned from them. She was a nurse, but because she was tall, she had a bad back. She became a medical social worker and did what she could. And then some doctors said to her, "You're never going to change things unless you become a doctor." So there, at a later age, she became a doctor, graduating towards the top of her class. And she brought modern science into hospice care. And she was a Christian. If you read her biographies, she was called to serve, just like Florence Nightingale. And it was a Christian ecumenical service to the public. She debated within herself whether or not to create an order of nuns or monks to do the hospice mission. But she decided to make it a Christian ecumenical outreach to everyone. And that's what hospice is supposed to be. I'm a nurse. I serve anybody, no matter what they are or who they are, and we're to love all. That was the mission. So she, in the United Kingdom, they actually use, I was going to talk about this a little later, but I want to show you this. In the United Kingdom, they use heroin for pain control. It's diacetyl morphine, chemical name. It has 2 acetyl groups on the morphine molecule. This is morphine, this is heroin. So when someone dies of a heroin overdose, heroin is very, very quickly metabolized into morphine. They die of morphine. What does morphine do? It shuts down the breathing and other things, and people die. Anyway, The morphine or heroin are fine to use. They're great pain relievers for certain kinds of pain, especially certain kinds of cancer pain, not all. Some kinds of patients, like spinal cancer, morphine won't touch it, probably, and you can increase the dose. Some patients have intestinal cancers or spasms, and I remember a case, I was the charge nurse in a facility. The nurses were just giving higher and higher doses of morphine, and the patient was complaining about cramping. So I called the doctor and I said, I need an antispasmodic. And we got the order, we gave her Bentel, is what we used at the time. Within 15 minutes, the pain had gone. But if they had continued with the morphine, the patient would have died. So sometimes people die in healthcare because of ignorance, and sometimes it's because it's intentional. Now, people want to say, or people ask, why are the decisions that are being made with the feudal care committees, the ethics committees, and so on, why are doctors doing what they're doing? Why are the legislators and judges making the decisions they make? Well, we didn't need a new ethics system, but somehow we got to a new ethics system, and most people don't understand that. They may have heard about the Tuskegee syphilis experiment in Alabama, but this was like 40 years long, from 1932 to 1972. The doctors decided that they were going to let black syphilis patients live their lives without being treated. They said, come to the clinic, we'll give you free health care and a lunch, and even for your family, and what they wanted to do was study the dead patients once they had died of syphilis to see the end stage of syphilis. And so for 40 years this experiment was running, and they never told the black husbands or fathers, the wives, the children. Sometimes the wives got syphilis from their husbands who had syphilis. So it spread in the community. It is about as evil as you can get, reminiscent of Nazi Germany, but this was in the United States. The press found out about it in the early 70s. So the Congress passed the National Research Act in 1974, which formed a commission of 11 people. And most of the people on that commission were not trained philosophers or ethicists. Some of them were doctors and other things, but they were not trained ethicists. There were 2 out of 11, and those 2 were not really pro-life. Anyway, that commission was called the Belmont Commission because of where they met, and the report that they came out with 4 years later was the Belmont Report. And in 1979, most people don't know this, the Belmont Report conclusions was published in the Federal Register, meaning it had all the force of law for all the federal government. And what it dealt with were many things: research on embryos, research on fetuses, research in any university, all the federal or the national the Health Commission, the County Health Commission, the State Health Commission, or Health Department, excuse me. And so all of them were following these ethical principles. And the Belmont Report created, or they broke up ethics into 3 major principles: justice, beneficence, and autonomy. We hear a lot about autonomy today, or patient self-determination. We're going to respect the patient's rights. It's almost like gospel now. And the 4th one, but it's not really a principle, but it's a standard, the standard of informed consent. Everybody's supposed to have proper information about any drug they get, but this is not done. I remember caring for a 20-year-old in the rehab hospital back in 1990, and she had taken an implantable contraceptive. And you know, you read sometimes in the magazines, they'll have a beautiful picture and the woman take this birth control method, and then the next page they have all this fine print and stuff. Well, I saw what happened with the fine print. She was a beautiful 20-year-old, permanently a stroke victim, major stroke, permanently disabled forever, could not move. And that was because she took one of these implantable contraceptive sticks. It was implanted under her skin, and she stroked out. And that's still happening today. And there are other things. Every medication, whether it's Tylenol is one of the biggest causes of liver failure. But the doctors aren't telling their patients that when they say take a Tylenol. Anyway, the three principles became, the system became called principalism or federal ethics. And it was passed on to all universities that were federally funded. And basically all universities are federally funded somehow. So if any university getting any federal money, they have to follow this. And it also means that all the doctors, all the nurses, all the lawyers who became the judges are educated into federal ethics, principalism. This is the first time in history, at least in the past 2,000 years or how many thousands of years, that we have a Congress or a government saying, this is what is ethical, not the church saying what is ethical or right. But almost nobody noticed this. Now, if you go online, you can read an article, What is Bioethics? By Professor Diane Irvin, who explains it in great detail. But justice for an individual is what we want as a patient. But their understanding of justice is an economic interpretation, a fair distribution of what they believe are scarce healthcare resources. So they say, oh, that patient, well, we'll make him brain dead even though he's not, because we don't want to spend the money. We'd rather spend it on other people, even if we don't know who those people are, and even if we don't really care about that patient. It's not personal. We're just killing that patient because we don't believe that that's just. Their idea, the worldview is different. It's switched. So it's all about this economic justice. Okay, then it's like a shell game. If that doesn't work to justify killing the patient, they'll use beneficence. Well, beneficence means doing good. You say, great, do good to me, care for me. No, that's not what it means. It means the good for society. The greater good of society is utilitarianism that Julie mentioned. So they can argue from different points of view. If they can't justify it one way, they'll use the other principle. And if they don't do that, then they'll use autonomy or respect for the person. And again, you say, great, respect me, follow my decisions, but it's a one-way street. And especially if it's a severe healthcare situation, you probably can't talk for yourself, so there's a surrogate who's making the decision for you. Quite often, it could be a court-appointed guardian or conservator, and sometimes the courts will say, no, I'm not going to take the father or the husband or the wife and make them the guardian. I'm going to get this guy who's a professional guardian and appoint them to make the decision. And so you have the person laying in the bed as a patient, and then whether it's assisted suicide or refusal of treatment, the surrogate is going to say, I don't want food, I don't want the tube feeding, or I do want assisted suicide. But assisted suicide, if you can't take that medication in, is euthanasia. There's no difference if somebody else is doing it. Now, going back to Cicely Saunders, that was in 1967 that she finally formed her hospice, St. Christopher's Hospice, which is still there in London, England. But there was a problem. She came to many places around the world and talked about hospice, the wonderful mission, pro-life mission, relieving pain, and everyone said, great. And not everyone, but a lot of people did. And it caught on. And one of the people who was very interested was Florence Nightingale. She was the Dean of Nursing at Yale University, and she was pro-euthanasia, though. And she formed the first hospice in America, the Connecticut Hospice, 1974. And so you had this dichotomy between pro-life Cicely Saunders type hospice, which is what the public knows about, and the culture of death, Florence Nightingale type hospice, which has been there all along, under the radar. And one of the other people who formed a hospice in early 1970s was Mary Labiak, hospice of the Florida Sun Coast, that killed Terry Schiavo. Okay, so anyway, in the early years of hospice in America, you have Ira Byock and some other doctors involved in hospice. But Ira Byock is a secular humanist. He's not a Christian. He's self-admitted secular humanist. And he wrote a book called Dying Well. Now, euthanasia means EU means good, Thanos means death, so good death. That's what euthanasia is supposed to be about. He wrote the book Dying Well, well dying, euthanasia. Okay, that's how I think of it. He is anti-euthanasia in public and probably in private, anti-assisted suicide. He goes around the country saying he's pro-life, but he is enthusiastically in support of Planned Parenthood, abortion, and in his book, Dying Well, he gives stories about how to hasten death. So I don't know why he can, or how he can call himself pro-life. He is the one who almost single-handedly tainted hospice, at least the outreach to many in the public, through terminal sedation. Terminal sedation is used in not a majority of cases. Patients have severe agitation at the end of life. And so instead of using terminal sedation to ease agitation, you just terminally sedate the patient. They're sedated. They're in a medically induced coma. They can't take in food or water, and therefore they die. You or I would die. You could be perfectly healthy. Now, Terry Schiavo, for example, except for her brain injury, she had some bone injuries from the attack that night, but she was perfectly healthy according to her doctor, Dr. Gambone. I have the medical records at the Hospice Patients Alliance website, the testimony, you can read about it. Every system in her body was healthy, except for the brain injury. She had hydrocephalus, and they didn't treat it. But anyway, they took away her food and water, and she died the same way. In hospices, they sedate the patient. It looks very pretty. It's peaceful. And that is one of the main ways of doing stealth euthanasia. People don't know because it looks so peaceful. And they lie to the family and say, oh, your loved one is nearing death. Because if you take morphine, it mimics the same symptoms of the active phase of dying. If you go to the website, we have a long list of the signs of active phase of dying. That's the last 2 or 3 days before a patient really dies. And yes, you can, not always, but pretty much you can predict that the person really is going to die if they have the majority of those signs, like purple knees, purple feet, their hands and feet are cold, their breathing changes dramatically, drastically, the urine is almost none, it's brown or red, things like that. Their mouth is open. If you've seen it, then you do recognize these things, and that is actually the most sought after page on our website, is the signs of active phase of dying. But morphine drops the blood pressure, It slows the breathing, and if you overdose enough, it will stop the breathing with apnea, and then the breathing starts again, starting and stopping, and that's exactly what some people do at the end of life. So morphine induces the symptoms of dying, and then the people think, oh, yes, the nurse is right. He's really dying. But if you give Narcan, which is the antagonist for the opiate, morphine, or fentanyl, whatever, they come back, and they live. So they weren't really dying. We've proved that in some cases. There are cases where people have been saved, but they were sure that they were dying, but they weren't. They were lying. Anyway, the Hospice of the Florida Sun Coast and the Missoula Demonstration Project in Montana were what were called rallying points regional centers of something called Last Acts. It was a coalition of hospice people and organizations to promote hospice, but they weren't pro-life hospice. In any case, I handed out this list. The name changes were done intentionally of the Euthanasia Society so that people would find euthanasia more palatable. So they changed it to Society for the Right to Die, Concern for Dying, Choice in Dying. Okay? So in about 2001, Choice in Dying, which was promoting the advance directives, the living wills, everything about limiting care, not guaranteeing care, merged with something called Partnership for Caring, which Mary Labiak and Ira Byack had formed. And it was to promote hospice and end-of-life care, but also to change America's thinking about dying, death and dying. You hear a lot about that. We got to change how people think about death and dying and make it more acceptable. Well, people are always, they've been dying since the beginning. So we don't have to, what we need to do is care for the patients until they die. All of us are dying until we actually are dead. We are living until we die. So when they talk about dying, the dying process, yes, there are signs at the end of life, but the mission of hospice was to care for people, relieve suffering, and help them to live as best as they can until the moment they die. That's the true mission. And something happened. These people, now Ira Byack was a member of Choice in Dying. Choice in Dying was the new name of the Euthanasia Society. So obviously he's not pro-life as he goes around and says. But there are people in the pro-life movement who think that he's pro-life because he opposes assisted suicide. He opposes euthanasia. He debates with people against assisted suicide and euthanasia. But he has brought culture of death into hospice. And the number of people dying under assisted suicide is maybe in the hundreds, 1,000 or so. Not really that many. But there are hundreds of thousands who are dying through stealth euthanasia. Undeclared. You've got about 5,000 hospitals in the country. You've got about 5,000 hospices. If each of them killed or hastened death of 10, that's 100,000. You've got 20,000 nursing homes. If a nursing home hastens death of 10, that's 200,000 right there. That's 300,000 easy. And it's done in many, many different ways. So, anyway, what you have is people training the trainers. The change for Partnership for Caring and Last Acts, the actual Choice in Dying merged with Partnership for Caring, merged with Last Acts, which was the Hospice Coalition. So you have the euthanasia with hospice. And then in 2004, all of that merged with the National Hospice and Palliative Care Organization, which controls all of hospice pretty much in the country, or trains the trainers, the managers, the administrators, the doctors. You also have George Soros, who funded a lot of evil things, but among those evil things is the Project on Death and Dying, which gave millions to train doctors and nurses in different programs in this culture of death way of thinking about end-of-life care. If you want more information, I just want to share this with you. Go to lifetree.org and study the timeline there. You'll see the funding of the changes and the Bellberry Review by Ione Whitlock. The website of Hospice Patients Alliance is hospicepatients.org. We have it on the brochure over there. Okay. I see we're running kind of long. I would like to quickly go over a couple of things. In stealth euthanasia, there are many ways of killing a patient that you need to be aware of. And I'm going to run through these somewhat quickly. You can come up to me later and get this. No food, no water is done. Giving morphine to a COPD patient will kill them very quickly because they have a poor respiratory effort and they stop breathing. You can give the wrong doses of medications. I knew a closer, a killer nurse, who changed the concentration of a cartridge for a pump of morphine from 20 milligrams per cc to 50 milligrams, and he snuck it in, but we caught it, and we saved the patient who was in her 20s.
Ron,
Yeah.
could you also explain closer?
Okay, yeah, a closer is a killer nurse. They're known, they know that they're killing, and they're hired to kill. Okay. If you deny oxygen to a patient who needs oxygen, it tends to decrease them. They go down. You don't have to just kill a patient. You can do little things that depress their well-being by violating the any standard of care that you violate will tend towards death. So if you give antibiotics to a patient who has no water, you kill the kidneys. They're going to die. You lay the patient flat when they have difficulty breathing, or you lay the patient flat when you're feeding them, or you sedate them and then feed them. They get aspiration pneumonia and they may die. I've heard people call with all of these family members that are in anguish because their loved one was killed. You refuse to treat a simple urinary tract infection or a respiratory infection when that's not the terminal illness. You give multiple medications at a time, and they're going to have all kinds that are not needed. They have adverse effects. You remove the this is very common. In true hospice, you remove the meds at the very, very end, when the patient's almost on their last breath. Because they can't swallow the pills. You could give them rectally or whatever, but they're not going to do anything because they're really, really dying. But in culture of death hospice, it might be a year before they die, or 6 months before, or a month. They take all the meds away from a heart patient, a stroke, a high blood pressure patient, and they precipitate the acute disease, and the patient dies. I'm going to try to finish real quick here. Some patients have had the oxygen turned up very high. That has killed them. I had another patient, they had oxygen with a mask, and the nurse turned off the oxygen and held the mask over the patient so they could get nothing. They suffocated. They send patients home without treating the disease, like a pulmonary embolism. They give potassium without any lab studies, so they stop the heart. That is done. Coumadin, blood thinners, Xarelto. They give that too much and the person bleeds out. They remove the blood pressure drugs from a stroke patient or a high blood pressure patient. In the brain injury cases you've been talking about, what they do is they flood the body with water to preserve the organs for transplantation, even though the patient could recover. But if they flood the body with water, it increases the cranial pressure and they kill the brain. Because all they want is the organs. They don't care about the person. These are all different things that are done. And I want to recommend that everyone get this book by Dr. Lee Heeb, H-I-E-B, Surviving the Medical Meltdown. I could probably talk for several hours, but I can't get to it all. There's some good information, and things are not really good, okay? You already know healthcare in crisis, society in crisis. These are intentional, and our society is being destroyed from within. Healthcare is actually going to get really bad, and it's going to get worse. And the people need to know how to care for people without going to the hospital, as Julie said, and so on. So, anyway, thank you for the opportunity.
Well, as you can tell, Ron is one of the brave nurses who's speaking out. He is a very, very important resource for you. So we're going to take a break. It's going to be a little bit shorter, so please don't go too far. And if you want Ron's materials or Mary Kellett's materials, who will be our next speaker, please take them right away, because right after Mary speaks, we're going to have to get to the airport. So we'll take about a 10-minute break. Okay, thank you.
I'm going to disconnect mine. Oh, do you need my cord for yours? You don't need this one? Okay. Do you have a place to plug in your computer, or don't you need to plug it in?
I need to plug it in.
Okay.
I just have to figure out where.
And I'm going to leave this one plugged in. What do you need?
Well, I'm just wondering how I can have my laptop here to look at. Maybe I can move this over a little bit.
Yes, why don't we just move all of this over?
And then I this. Let's just try this. Where does this go? This goes over here. Is that what we can put in there?
Yep. Right there. Okay, how about if we just put it like this?
Well, I just want to see it. You know what I mean? Instead of turning.
Well, we're going to
I
have
know.
to.
Like this.
Yeah.
Like that.
That'll work. Well, we're going to have to. The cord's on the wrong side. That's what the problem is. You're not going to.
Well, how about if we turn it on and see what it looks like?
Okay.
Turn on the projector and see if it.
Well, it is on.
Oh, why does it show me?
I don't know. I do not know. You want me to go get some help? Okay.
Because if I thought it was supposed to just show up, right?
Is it not? It might show up there. I don't know.
What did you do?
Nothing. I just turned my computer on and it showed up. I will go get some help. Hello.
Encourage others
to my computer.
Where's the projector?
Right there. She said it's on.
Where are they going to place it? That's where they're placing the projector?
I guess it shines from there right up to here. So she's going to.
Really? That's odd that it would. Okay.
Yeah.
We're going to need it up on a chair, maybe?
Before she had it up there.
She did have a powerful chair. Oh, okay. I see how it's. Huh.
So I don't know how to. I mean, she plugged this in and she said it just started right up for her, so I plugged it in. I don't know if it's on, is it? I mean, it doesn't look like it's on, does it?
Yeah. There's a button there. Power.
Well, that's on.
That's, went from red to green.
That's right. Maybe this is it. Even. It looks better than it did before anyway, so I think we're moving in the right direction.
Good. Good.
Well, I don't know.
I'm starting to break it.
Now look at it.
Oh, it's coming up. Yes. Now, can they turn these lights off?
Yeah, okay. So let's see.
Now, can you go full screen? You got the presentation.
Yeah. Okay, there. No, it's perfect.
No, this is still one.
How do you?
Other way.
There? Oh, no.
Hang on.
That's two. Okay, a little bit
There.
more. No, a little bit more. A little bit more to the right.
Okay.
There. Oh, there.
Let me help you out.
That looks pretty good. Did we do this right now?
I can back it back to where it was.
There's a
before.
cord.
Oh, we're just trying to. I want to.
Maybe you need to stand on this side. So that it's. Stand on this side.
Okay.
So that the cord doesn't go over the light. No, go back forward. You took it too far back.
See, now I just have to get that. Step over.
That looks good. Right there. There. Perfect. The top edge is right at the top of the screen. Nice. Here.
Okay.
It can be. It can be. That is for sure.
Let me get you.
Okay. Is this the microphone right there?
Which one?
This is the one? Is that a microphone? I think they wanted me to do this.
Which microphone?
This one must be attached to that.
To the camera.
Yeah. Okay. That's good. All right. Sexy.
Just trying to make this so it's not as circular.